Hi, I'm Jaimy Lee. I'm the executive editor at MM&M. I'm here today with Sanjay Virmani, EVP at Indegene. Thank you for being here today.
It's great to be here today.
So to start, why is software as a service a growth opportunity in life sciences?
Well, it's really part of the larger move towards digitalizing everything from transactions to relationships in all industries. Now in healthcare in particular, there is another additional force at play, which is the need to improve the connectedness and the transparency between all different healthcare stakeholders to improve the quality of care for patients. And software as a service compared to traditional software does have many advantages, in terms of agility and mobility and openness. And that's why it is a significant, growth opportunity, I think. Having said that, I don't really think that software as a service is really a model, especially in areas like sales and marketing in life science manufacturing.
Why not?
Well, first of all, a lot of the organizations out there are merely trying to digitalize the past realities. Past realities, for example, where a lot of the healthcare provider customers were solo practitioners. This has been declining for some time now. It was about 60% in the early 2000s. Now it's about half of that. Or the changing reality that a lot of the healthcare provider customers are solo decision makers. In the last couple of years, the use of treatment protocols has more than doubled. And in fact, 2/3 of physicians and 2/5 of surgeons report that they're not the only voice in decision making anymore. And then beyond the protocolization and the institutionalization of healthcare providers, there's sort of a vast change in the consumerization of healthcare, where consumers are not just more involved, looking for information and the like, but they're also getting a lot more data-driven, with wearable devices and mobile applications and the idea of a quantified self. So from that perspective, and then of course if you look at payers becoming completely outcome driven. So from that perspective, providers getting more driven by institutions and protocols, consumers getting driven by more quantified information, and the payers getting driven by more of the outcomes. There's a lot of changing realities to deal with. But besides that, I also think that there is something fundamental in the economics of, software as a service. In the first few years after the move from in-house software to software as a service, there are some inherent savings, reduced capital spending and amortizations and maintenance and support and the like. But then after that point, if the technologies are really designed for the realities of the past, and there's no more savings to offset the recurring annual charges, then is the result going to justify the expense?
For life sciences manufacturers, how do you think they need to rethink their sales and marketing functions?
Let me start by saying that technology that improves connectedness between life science manufacturers, sales and marketing, and any function for that matter, and the other stakeholders is a positive force. It increases the value of the healthcare system. It increases the value to the patient at the end of it. But the question is, what about the innovation to address those changing realities? Or what about the integration of technology into the sort of broader digital supply chain of content or analytics or compliance, which is another big consideration in the healthcare industries in particular. And I think for these things to happen, software as a service organizations and their customers, which is the life science manufacturing, sales, marketing, other functions, medical functions, are going to have to look a little bit different in the future compared to the way that they look today. Today, most of these organizations are paid for a certain volume. For example, the provider of a customer relationship management or a patient engagement type of software as a service to these sales and marketing functions is usually paid on the number of seats. Or even if you look at outside of the life sciences domain, for instance, a software as a service company that provides electronic medical records to the provider community is paid on the number of seats of physicians using their technology. I think that these solution partners and also their customers in these life science manufacturing organizations are going to have to get more outcome focused, a sort of outcome as a service model.
And so how has the industry's shift toward value affected software as a service companies?
Well, it hasn't affected them yet, but I think it is inevitable. I think these organizations are going to have to evolve to something like outcomes as a service model. For example, in 2020, some estimates suggest that about a fifth of all healthcare payments to providers are going to be linked to value. And this is a fact. So I think that all of these organizations are going to have to rethink their cultures, their systems, their sort of relationships with each other, and really focus more on the outcome as opposed to just what goes into all these technologies and services today.
How long do you think this evolution is going to take?
Let me tell you how long I think it's not going to take first. I don't think it's going to take decades. I think it's a matter of a few years. For example, life science manufacturing organizations, sales and marketing functions could start adopting a sort of result as a service model first, where at least their partner organizations and their departments are focused on a result, such as prescriptions or patient starts or number of patients on therapy after 3 months, something like that. It's still not an outcome, still not a health outcome, but it is certainly a result as opposed to just volume. We already have partnerships like this at Indegene today. And I think from this point, the solution providers and their customers are going to start to evolve to create those innovations and those integrations that really improve the health outcome. And then they're going to be on the hook for delivering and measuring that improved health outcome. Actually, I think that this is part of a broader change that I see happening with healthcare overall, which is where a lot of these organizations, whether they are manufacturing organizations or health delivery organizations, even payer organizations, are beginning to realize that the sort of largely volume-based buyer-seller relationships that they've had in the past is not really going to work in the future. They're going to have to evolve to more of a sort of conjoined co-execution of better care type of a scenario. And in that scenario, the business outcomes for all of these organizations, including the solution providers, is going to get much more linked to the health outcome. And I think that future is not very far away.
Great. Well, thank you so much for your time, and thank you for being here.
Thank you. It was wonderful to talk to you today.